Okay, Ayala, you ready?
I am ready when you are.
Okay, welcome everybody. Welcome to tonight's webinar. My name is Rafi Shulman, and I'm the co-founder of Olim Advisors. I'm here with Ayala Laub, who is the director of the Shira Pransky project. First of all, just want to let everyone know that over 400 people have registered. So, it's great to be able to get in front of so many people. And obviously, this is a topic that a lot of people are interested and concerned about. And so it's great to see so many people that have registered and will be joining us tonight. Just a brief introduction about me and Olim Advisors. So we started Olim Advisors back in 2017 with two goals in mind. The first goal is to encourage people to make Aliyah. So as people have been thinking about it and want to come to Israel, we, in essence, guide them through the process. So all these decisions that people have to make, from choosing a community to finding a school to finding a home, we guide them through this process and help them make these decisions. And then the second goal is, once people are here, we help them overcome the challenges and adjust. As many of you know, as many of you who live in Israel know, adjusting to life in Israel can be challenging at times. And so we really work very closely with our clients. We go with them to the bank, the different government offices. We help them choose a healthcare provider that Ayala is going to be talking about. Anything from the big decisions to the small questions, we're here to help. And so just keep in mind, if there's anything that I can do for you, I'm going to put my contact information in the chat. Feel free to reach out to me if you have questions about Aliyah or about adjusting to life in Israel. We're here for you and we're happy to help. One thing to keep in mind is that we're going to have a Q&A session at the end. So put your questions in the chat window, not in the Q&A, but in the chat window. And we're going to try and get to as many questions as we can at the end. We've already gotten a lot of questions that people have emailed us before, so we're going to try our best, but just keep in mind, we do have a limited amount of time. If we don't get to your questions, or if you have follow-up questions, feel free to reach out to Ayala directly, and she'll be happy to help you. Ayala is going to be giving you the contact information at the end, so you'll have that information, and you'll be able to reach out to her as well. So with that in mind, I want to hand it over to Ayala, and it's all yours.
Thanks so much, Rafi. Thanks so much for having me. Thank you to everyone who's joining. It's really exciting to be here tonight. It's our first webinar of 2021 for the Shira Pransky project. We're excited to be back. We're looking forward to hopefully a better year ahead. And with that, I'll introduce myself again. My name is Ayala Laub. I am the director of the Shira Pransky project. And tonight we are going to be learning all about navigating the Israeli healthcare system. I call this session Israeli Healthcare 101. It's basically all the basics and all the tips and tricks that you need to begin your understanding of the Israeli healthcare system. So first, I wanted to give a little background about the Shira Pransky project for anyone who has never heard of us. Our mission is to bring successful healthcare navigation to English-speaking Israeli immigrants. We want to make sure that we are alleviating the stress and challenges of the medical system, and to make sure that healthcare is not a struggle of aliyah. As Rafi said, moving to Israel has its challenges, is not always easy, and our focus is to make sure that healthcare is not one of those challenges. We do this in three main ways. The first is information outreach. The second is what we're doing tonight, community education. And the third is individual assistance. And I'll give you more information on all of those things at the end. The organization was founded by Gabe Pransky, our founder and now chairman of the board. He founded the organization member of his wife, Shira, Zichrona Livracha, who passed away after a long battle with cancer in Israel. And basically, he realized after she passed away that there were so many rights and benefits that they had missed out on purely out of ignorance. So he started the organization in her memory, and to make sure that all Olim, regardless of the severity of their medical situation, always had the information they needed, always had access to their care. So with that, let's get into it. I like to start with this chart here. We're going to delve really far into the Kupat Holim, as you see, I guess, if you're all looking at your screen on the left side of the chart. But I'd like to start with a little bit of a background on the Israeli healthcare system, and that's starting with Bituach Leumi, which is the National Insurance Institute. I find that people are always a little bit confused as to where the different benefits come from. You know you have health insurance, you know there are all these other additional benefits. So in fact, all of these benefits are under the auspices of Bituach Leumi and the National Insurance Institute. The first part of it on the right here, I called other benefits. That includes disability, CUD, which is long-term care insurance, and other payments such as car accident insurance, workplace accidents, etc. And then on the left side, we have our Kupat Holim and our Shaban, which is supplemental insurance, which we'll get to later. But I like to show this background for a couple of reasons. First, to understand that everything ultimately does come back to Bituach Leumi. The reason the Kupat Holim are separate is because Bituach Leumi felt it was too much for them to be responsible to personally insure every single Israeli citizen and resident. So they sort of outsource it to the Kupat Holim. But ultimately, this is something that's under Bituach Leumi and is part of your monthly payment to Bituach Leumi. For any of you who don't know, Bituach Leumi monthly payments are paid by your employer. If you are unemployed and have been living in Israel for more than a year, please just check in with Bituach Leumi and make sure that you have some system to pay them, because they probably won't tell you, and you'll probably just get a really hefty bill in 7 years. So make sure to check that out. Again, like I said, we're going to focus tonight a lot on healthcare and the Kupat Holim, but while we're discussing Bituach Leumi, there are a couple of important points that I like to make specifically that are related to healthcare and medical care, and that people might not be aware of. The first is about disability insurance and CUD insurance. Again, CUD is long-term care. Disability insurance, you are only eligible to apply for it before retirement age. In Israel, the retirement age for a woman is 62 and a man is 67. And if you apply for disability and receive it before retirement age, it will continue after your retirement age. But if you don't, then you will only be eligible for CUD, which is long-term care. And that benefit is a little harder to get because you need to basically prove a pretty severe decline in your ADLs, your activities of daily living. So this is not a chief reason to move up your aliyah 10 years. But if you're someone who thinks you would qualify for the monthly disability stipend and you're nearing retirement age, it might be something to consider. And the other thing to point out in general with Bituach Leumi is that all of the benefits of Bituach Leumi are regulated by the government and are available to all Israeli citizens and residents. I highlight residents because this is something we run into a lot, particularly when dealing with healthcare, that residency and the status of residency is something that becomes very important in Israel, especially, like I said, when we're talking about healthcare. So if you are someone who would be considered a returning resident, known as a Toshav Choser, that means that you declared Aliyah basically at any point in your adult life and since have left Israel for an extended period of time. Or if you're someone who's planning on making Aliyah and you're not sure that you're actually going to be able to maintain residency here, you don't think you'll actually be here 6 months out of the year. So I really encourage you to email us. Again, the contact info will be available on the slides at the end. Please email us. It can be a complicated issue that I don't want to delve into now, but make sure you reach out to us because I don't want anyone to get stuck without healthcare. So now that you have a background on the Israeli healthcare system, we're going to get into the most frequently asked question to the Shira Pransky project, which is, which Kupat Holim should I choose? So the most important thing that I tell everyone who asks about healthcare in Israel, and this is true of people who have not moved here, and this is true of people who are already living here, that you need to understand that all of the Kupat Holim, the health funds in Israel, must offer you the same services and benefits. It is a law. They are regulated by Misrad Habriut. Every year, Misrad Habriut, more or less every year, depends what's going on with the government, of course. But every year, the Ministry of Health votes and decides on which services, whether it's medications, diagnostic tests, any of those types of things, are part of the Sal Briut, which is called the health basket. And if it's in there, every kupa has to cover you for it. And the other wonderful thing about Israeli healthcare is that they are not allowed to deny you for pre-existing conditions. So I know a lot of people who come to Israel, they're really worried. They often come to us with a host of certain pre-existing conditions or medications that they've already been taking, and they're really concerned. Don't worry, everything's covered, even if it's a pre-existing condition. Okay, so now that you know all these kupot are the same, what are they? How do I actually choose them? So in Israel, there are 4 health funds. They are Klalit, Maccabi, Meuchadet, and Leumit. Their logos are here on the side. None of them pay me, don't worry. The order that they're listed in is the order of their size. And again, they all offer more or less the same services. But how do you actually choose which one is right for you? So we tell people to look at 3 things. The first thing to look at is geography and accessibility, right? They always say in real estate, location, location, location. Just because every kupa has to offer the same services to everyone doesn't mean every kupa is as prominent in every location in Israel. So it's going to be really important to see which kupa has more clinics in the area that you're moving to or the area you live in. If you're someone who relies on public transportation, you're really going to want to see, if there's a clinic for us to the kupa that's on that bus line, that might be a major factor for you. The second thing we tell everyone is to ask for recommendations. Really see, especially from English speakers who are already living in the community that you're a part of, see where they're happy, see which Kupa has the best English speaking doctors, because that, often is an important thing for new Olim, English speaking Olim. They want to be able to communicate with their doctor. Ask for recommendations. You'll be able to hear from a lot of English speaking Olim. Some are new, some have been here for many years, and they'll be able to give you some inside information as to which Kupa might be the best one for you. The third thing to check, and this is not for everyone, this is one of those slightly more specific things to check, but if you are someone who does have a pre-existing condition or you do have a unique medical circumstance, you might want to check to see what specialist works with what Kupa. What do I mean by that? Like I said, every Kupa has to offer you a cardiologist across the board. If you need a cardiologist, it doesn't matter what Kupa you're on, you will be entitled to see a cardiologist. But if you have some sort of unique heart condition and your doctor in the States tells you, listen, when you move to Israel, that guy in Israel, that cardiologist, he is the only one I want you to see. That doctor will take care of you. So in that case, you might want to see which Kupa that doctor works with, which Kupa covers that doctor, because like I said, you'll be able to see a cardiologist on every Kupa, but you won't necessarily be able to choose from any of the cardiologists. That's another thing to consider when choosing your Kupat Holim. The last thing about choosing your Kupat Holim that I like to tell everyone is that don't worry, you're not stuck. You are certainly entitled to switch Kupat Holim. Is it the absolute easiest thing you will do in your entire life? Probably not. Is it the greatest bureaucratic nightmare you will ever experience in Israel? Also not, somewhere in between. But you really aren't stuck. It's not something that I would, just flip-flop between Kupot every 6 months. It's not, a quick overnight process, and it does take time, and it is a big step. But if you really are unhappy under Kupa, or even if you're happy, but another Kupa offers more clinics in your area and you see they're popping up in your area, and just because of that you want to switch, you certainly can. My biggest piece of advice to anyone who is looking to switch Kupat Holim is to actually call someone and call a representative from the Kupa that you're looking to switch to, because even though they can't actually do the switch for you, they will very graciously and very eagerly assist you along the way, because it's to their benefit. The more people they have registered for their Kupa, the more government funding they get, and ultimately they have a vested interest in having more people join them. So that's in terms of choosing your Kupat Holim. People always ask about the costs, about the benefits. Overall, this is the basic plan. Again, if you're paying into Bitua Leumi and your taxes, then the Kupa month to month on the basic plan is basically free. There are occasional co-pays, but really it's not expensive, and overall you will more or less get all the care you need. But if you want some extra care, which I'm sure many of you do, we'll move on now to supplemental insurance. So this is our second most popular question after choosing your Kupat Holim, is what is supplemental insurance? How does it work? Do I need it? How much does it cost? Is it really worth it? All of those things. So I want to explain to everyone tonight how supplemental insurance works. Again, supplemental insurance, like the basic Kupa plan, is also regulated by Misrad Habriyut and cannot deny you for pre-existing conditions. I like to highlight this because it's a big deal to be able to pay in to get extra care for something and not be denied for any pre-existing conditions. In terms of the supplemental insurance, as opposed to the basic plan where there is literally no difference between the Kupot in supplemental insurance, it can vary slightly because they're all competing to try to have the best supplemental plan in order to entice people to join them. But overall, many of the plans are more or less the same, and it's not necessarily a reason to switch Kupot. So how supplemental insurance in Israel works is that every Kupa offers 2 tiers. We like to call them the precious metals. For those of you who are here and are part of supplemental insurance, they have lots of fun names like gold, silver, platinum, C, whatever, all of those names. Every Kupa has 2 tiers. The first tier offers a bunch of additional benefits. The second tier offers even more expansive benefits. You can't buy the second tier without the first. So you have to understand that there's 2 tiers, and you can basically buy into the first or the second, which will include all the benefits of the first. So what are some of the benefits of supplemental insurance? I could probably give a 3 to 4 hour lecture on the benefits of supplemental insurance, but I will spare all of you. And in short, I will tell you that some of the benefits of supplemental insurance, the most important one is dental coverage. The basic Kupat Holim does not have any dental coverage if you are over 18 or under 75. So for any of you in that age range, you will not have dental coverage if you only have the basic plan. And just to kind of give you an idea of the cost of dental care here, if you, for example, need a root canal and you are on the basic insurance plan, a root canal here will cost you upwards of 8,000 shekel. If you have supplemental insurance, a root canal usually costs around 1,500 shekel. So it really is a big difference, and that's something to consider amongst the benefits. Some other benefits of supplemental insurance include the ability to see private specialists and the ability to choose private surgeons and be significantly reimbursed and have very heavy subsidies on that. So that's another really great benefit that I know a lot of our clients really enjoy the comfort of that, because like I said, the basic plan is going to cover you for everything. If you need a surgery, you will get a surgery. You won't necessarily be able to choose your surgeon. You know, if your son needs their adenoids removed and you're going through the basic muscle, through the basic, health basket, and you're going through the public service, so they're just going to call you and say, hey, this pediatric ENT is available this day. We're scheduling your son for an adenoidectomy. But if you want to choose your surgeon, so supplemental insurance often gives you that benefit at a pretty heavily subsidized rate. People always ask, who should join supplemental insurance? So really, between you and me, I get in trouble at work all the time for giving recommendations that I'm not supposed to, because we're not really supposed to give official recommendations. But now that we've been chatting, via this screen for a few minutes, let me tell you as a friend, if you can afford it, I highly, highly, highly recommend you get supplemental insurance. There are so many benefits to the plan, and we find particularly our clientele that come from the US find it very comforting to have some extra access and some, more cushy care. So I really, really highly recommend that everyone who can afford it should join it. If you are limited in your budget and you find that it's not feasible for you to have your entire family on the plan, the populations that benefit the most from supplemental insurance are going to be women in their reproductive years, children, and the elderly. So sorry, young middle-aged dad, you're out. But really, in all seriousness, I really encourage you, if you can afford it, to put your entire family on the supplemental insurance plan. In terms of the cost, it goes by age brackets. So if, the younger you are, the less expensive it will be. For children under 10, for the second tier, which is the highest level, it's something like 25 shekel a month. If you're over 80, it's going to start to cost more and probably cost more like 180 or 200 shekel a month, which sounds like a lot, but just remember that not every member of your household, you probably don't have 6 people in your household who are over 80. Also, many Kupot offer family plans, and by the 4th child and on, it's typically free. And again, you really get a lot of benefits and you're not paying for any other insurance. So that's just something to consider. In terms of when to join supplemental insurance, for any of you who just made Aliyah or any of you who are watching this that have not yet made Aliyah, join supplemental insurance within 90 days of making Aliyah. I cannot stress this enough. Even if you decide you're not going to use it in the end and you're going to cancel, it's worth it. If you join within 90 days of Aliyah, the supplemental insurance plan, the Kupot will waive your wait times. Every Kupa for their supplemental insurance has certain wait times for certain benefits. This is because they don't want people to simply, join in when they want a benefit and then leave. They obviously need to be able to pay for these benefits, and that comes from the payments from your supplemental insurance. So there are certain benefits that do kick in immediately, but often most benefits have between a 3-month and actually a 24-month waiting period. The average is around 6 months. But if you join supplemental insurance within 90 days of Aliyah, all those wait times are going to be waived and you'll be able to enjoy all the benefits of supplemental insurance immediately. So that's a really important thing to remember. Excuse me. While we're talking about supplemental insurance, I'm going to touch on private insurance because I know a lot of people ask about it. I'm not a private insurance agent. I don't pretend to be one, but I'll give you a little bit of insight from our perspective about private insurance. And if you are someone who is interested in pursuing private insurance, you could certainly reach out to us and we'll give you recommendations of the right person to speak to. But a couple of things just to know about private insurance is the first is that in Israel, private insurance can deny you for pre-existing conditions. They can make their own rules as to why they're denying you, and they will deny you for pre-existing conditions. Private insurance in Israel, because they're effectively competing with a free option, they can sometimes, they don't want to just pay out for all these extra things. So they will be pretty difficult about pre-existing conditions. We know people who, one time went to get an MRI on their back, and now they've been denied for everything related to their back in private insurance. So supplemental insurance, you won't have that issue. Private insurance offers some things that supplemental insurance doesn't. The biggest thing that private insurance will offer that is not in the supplemental insurance package through the Kupat is what's known as catastrophe insurance. And what this is certain insurance for if, God forbid, someone needs an organ transplant, if, God forbid, someone needs an experimental drug for some sort of cancer. So sometimes private insurances will have plans to cover those things that will definitely not be covered by your supplemental insurance. Sometimes people find that they either have private insurance from, the country they came from, or they have it as a benefit through work. So it's important to, do the research, speak to a private insurance agent, reach out to us and see, because if you really do have a very comprehensive private insurance plan, it may be, redundant to have supplemental insurance. But more often than not, what I find for most people who just made Aliyah, that if they're looking for that extra level of care, that supplemental insurance is really a good place to start. All right, so you came to Israel, you chose your Kupat, you joined supplemental insurance because a friend recommended it to you. So now, what do I need to know? How do I access all these things? What do I do? How do I see a doctor? All of those fun things. With the Shira Pransky project, we like to say that there are 5 things that you need to know about your Kupat Holim. These things are going to be cyclical, like I have here in my pretty circle chart here. They're going to all connect to each other. You're going to be in the middle of all of them, and they're going to keep coming up. The first thing to know about your Kupat Holim is know your branch secretary. I know it's a little strange. Out of all the things I could have possibly listed that will most help you or that are most important for you to know when dealing with all of your medical care, why am I bringing up a secretary? I'm telling you, it's true. For those of you who have been in Israel for a while, you probably know this already, but if you don't, I'll fill you in on a little secret. Secretaries in Israel have magical powers. Basically, they control everything, and pretty much what they say goes. And that is true also in healthcare in Israel. So we highly encourage you to get to know your local clinic's branch secretary. They can really help with a lot of things. They can help you understand and access your benefits. They can help squeeze you into those appointments when you don't want to wait 6 weeks for one, and lots of other things. So that branch secretary, you are definitely going to make use of them, and they're a really good person to know and a good place to start. The second thing to know about your Kupat Holim is your family doctor, your GP. While your branch secretary is going to be the center of all your overall health care, your family doctor is going to be the center of your medical care. They are the place that you start and end. If you have some sort of medical issue, you go to a family doctor. If you think you need to see a specialist, it's usually a good idea to start with your family doctor. If you have gotten treatment externally, if you've gone for any sort of testing, it's good to come back to your family doctor. They're really the place to start. They'll refer you to everything you need, and they're really the center of your care. The third thing to know are these 2 words, and in the next slide, we're going to get into them more in depth and explain them further. But these 2 words, Hafnaya and Hitchayvut. Hafnaya is literally defined as a referral. Many of you, I'm sure, are familiar with referrals from other medical experiences. And the second, again, I'll explain it a little more in depth soon, but is a Hitchayvut. It's otherwise known as a Tofesh Shvaisrei, and we define it as a payment voucher. So just remember those 2 words, Hafnaya and Hitchayvut. The first thing to know about your Kupat Holim, which people who have been here for years sometimes still don't realize, is that your Kupat is responsible for you 24/7. By law, you're responsible is in charge of your care, in terms of your medical care, in charge of any diagnostic test that you need 24 hours a day, 7 days a week. Some of you might not know that, because I bet a bunch of you are thinking, well, wait a second, where I live, the clinic is open from 8 to 12:30 and from 3:30 to 6:30 on Wednesdays. Or maybe some of you are lucky like me and you live by a clinic that's open from 8 to 6 straight every day, but still, that's not 24/7. Your Kupat is responsible for you 24/7. When they are not open, they're responsible to take care of you via any external centers, whether that be urgent care or ER, and we're going to talk more about that also later. The fifth thing to know is your rights. Understanding your basic and supplemental rights are really the key to getting the best care in the shortest amount of time. I'm telling you, it will be the difference between you waiting 2 months for an appointment versus 2 weeks. It'll be the difference between paying out of pocket those couple extra times and getting that reimbursement. So, hopefully tonight will give you some insight And again, at the end, I'll share some resources that we have, but really, really take a minute, get to know your rights. And that brings us back to our branch secretary, because that branch secretary is certainly going to help you with that.
Just to jump in for a second,
Yes.
for people that joined late, I wanted to let you know to please post your questions to the Q&A box. We will try and get to the chat box. We will try and get to them later tonight, later in the webinar. And Ayala is going to put up her contact information at the end as well, so you'll be able to reach out to her. I know that there's a lot of information that she's sharing with you, and some of you might be a little overwhelmed, so don't worry, we'll get through it. We will also send it around the recording later this week, so you'll be able to watch all of it and see the slides. But if you have any questions, just post them in the chat window, and we'll try to get them at the end.
Amazing. Thank you, Rafi. Okay, so now we're going to move on to Hafnaya and Hitchayvut. These are the two pieces of paper that are going to get you everything that you need in the Israeli healthcare system, but it's important to understand what they are and when you need one and how to get one. So we'll start with Hafnaya, which is a referral. A referral, like I said, many of you are probably familiar with such a thing. You probably, have been to a doctor who's referred you to a specialist. So in Israel, basically how it works is pretty much any sort of care, any appointment, any diagnostic test, any lab work, all those types of things will require a referral. The 4 things I can tell you right now that do not require a referral. You do not need a referral to see your family doctor. You do not need a referral to see a gynecologist. You do not need a referral to see a dermatologist. And you do not need a referral for the flu shot. Pretty much everything else you need a referral for. People often ask questions, but what about this specialist, that specialist? For an ENT, do I need a referral? Well, the answer is it's going to depend on the month and which Kupat, because they change so frequently. But as a general rule, for pretty much most specialists, for any lab work, any blood test, any type of thing like that, you will need a referral. And your family doctor, like I said, is usually the good place to start. How do you get one? Just ask for one. Often if you are at a doctor's appointment, and let's say you're speaking to your family doctor and you're complaining of stomach pain, so likely your doctor on the spot will just print out a referral for a gastro for you, but sometimes they don't. So if they do think that you need to see any sort of other doctor, just ask them to make sure that they gave you that referral. And also referrals, sometimes you don't even need to go for an appointment. If you think that you want to get a regular blood test, you can just call the Kupat's office or even write online or on the app, which we'll talk about also later, and get your referral. Important things to remember about Hafnayot, about referrals, is that you want to make sure, and this is where you have to be a little proactive sometimes with your doctor, you want to make sure that the referral is really, really, really clear. And if you're not sure if you need one, you should get one. These things are going to become really important when we head over right now to Hitchayvut, Tofa, which is your payment voucher. How it works in Israel, like I said, is the Kupat Holim is responsible for you 24/7. And they do a lot of things what we call in-house, right? There are a lot of times that you will go into your Kupat building and all you need is that referral and you'll just go and get that blood test. However, if the Kupat doesn't offer a service in-house, then they need to pay for you to get it elsewhere. And that's not just the case in emergencies. So in that case, that's where a Hitchayvut, a payment voucher, is going to come in. And the way I tell people to remember it is that if you are going for any sort of specialist test, lab work, anything like that, and you are walking into a building where your Kupat's name isn't on the door and you're expecting the Kupat to pay for it, you need a Hitchayvut. It's required for any appointment that is outside of your regular clinic. And this is the Kupat's commitment to pay for that care and to pay for that treatment. How do you get one? It varies by Kupat, but typically you can submit for one online, or you call your branch secretary or go meet with them in person. And in order to get a Hitchayvut, you need a Hafnaya. So you're going to give in whatever referral you have. Let's say you have a referral for an MRI and your Kupat doesn't have an MRI machine in-house and they're sending you to a hospital to do an MRI. So you're going to go and give in that referral that says you need an MRI, and then you will be given a Hitchayvut, the payment voucher, to bring with you to that appointment for the MRI. Important to remember about Hitchayvut is that, again, make sure you have the proper paperwork. Some Hitchayvut are given quite easily. If you suspect you have a broken bone, and you have a referral for an x-ray, but there's no x-ray machine in your clinic, they're going to print you a Hitchayvut for an x-ray on the spot. You don't have to worry about them. But other Hitchayvut do have to go through some approval process. It may take a couple of days. If you're getting some sort of surgery at a hospital, you're going to go, a week or two in advance of that surgery and make sure that Hitchayvut is already in the process. Often it's just a technical process of making sure that you have the correct paperwork, that you actually need this treatment. Sometimes it can be more complicated. And again, that's where your branch secretary is going to come in. I really encourage you to work with them. They can help make sure you have all the paperwork and all of that type of stuff. If you are rejected for a Hitchayvut, it usually means that you are missing a piece of paper. Perhaps the Hafnaya, the referral was from a family doctor and you in fact needed one from a specialist. So just go back and make sure you have all the correct paperwork and try again. If you find that you haven't heard back from them or it's getting really close to the date of that appointment and you're feeling nervous, like you're not going to get one, a nice key word in this country is dahuf. Call them and tell them it's dahuf, and they will usually be able to get that done pretty quickly or even on the spot sometimes. And worst case, important tip, if you show up to that hospital and you either do not have a Hitchayvut or you have the wrong Hitchayvut, I'm telling you this happens sometimes, they give you the wrong piece of paper, the hospital's not going to accept it. Every Kupat basically has a secret office. Sometimes it's less secret and more open. Other times it really is hidden, where someone from the Kupat is actually sitting in the hospital, and they will often be connected to the clinics. So let's say, for example, you get to the hospital for pre-op, which would require Hitchayvut, and they've given you a Hitchayvut for the actual surgery, which is not the same Hitchayvut as the pre-op day. So just ask the secretary at the hospital to get you in to the Kupat secretary that's probably sitting somewhere in the back, and they'll usually be able to get a Hitchayvut brought over pretty easily. So that's all about Hafnaya and Hitchayvut. I know it's a lot of information, guys, but it's really important. Next, I'm going to go into urgent care and ER. Going back to what I said, your Kupat is responsible for you 24 hours a day, 7 days a week. This is true of if you need any urgent care or emergency room services. Now, I'm going to preface this entire section by saying that if you are experiencing a life-threatening emergency, do not hesitate to go to the emergency room. If you think your life is in imminent danger, call an ambulance and get to the emergency room right away. Call MAJA at 101 or call Hatsala at 1221. That being said, there are a lot of times where we know there is an urgent or emergent situation and we don't quite need to rush right away to the hospital. And if you do, your Kupat might not want to pay for it because they're going to say that there was no reason for you to go. So if you do find yourself in these situations, who do I call? What do I do? Where do I go? All of those types of things. So who do you call? Every Kupat has a moked, a hotline that is supposed to be open 24 hours a day. It's a little tougher now in these Corona times. The hotlines are pretty overwhelmed. So you might be on hold for a while. But every Kupat has this hotline, and usually during the day, they're used for things like making appointments or getting more information. But in the evenings, they're available for you to speak to a nurse or for you to be referred to an emergency room. If it's during the day and your Kupat is open, before you call the moked, I actually encourage you to call your clinic directly, ask to speak to the branch secretary that, of course, you know because you've gotten to know her. Ask to speak to a nurse, see if your family doctor is in, explain to them what's going on, and then ask for a referral, and they'll tell you where to go. So where do you go? There's going to be a difference depending on the situation. Sometimes you may be sent to urgent care. Sometimes you may be sent to the ER. In terms of urgent care, every Kupat kind of has a different structure with all the urgent cares. The most popular one, of course, is Terem. Fun fact, Terem is not just a little place for 15-year-olds on summer trips who forgot to drink on their hike and need an IV. Terem is used year-round, all day by Israelis who live here full-time. And so they're often the first thing people think of and the first place to go. And sometimes that will be true. But for example, Meuchadet in the Jerusalem area does not cover Terem because Meuchadet has their own urgent care in Jerusalem. And like I said, they're required to pay for all of your care. But if they offer something in-house, if Meuchadet offers their own urgent care, then they're not required to pay for an external one. So, just make sure you're aware of your urgent cares, which Kupat works with different ones. It's going to vary based on Kupat and based on the area. Sometimes you will be sent straight to the ER. Again, it's going to depend on the situation. What do you need? If you're going to the ER and also sometimes urgent care, you're going to need a Hafnaya. And depending on the urgent care and definitely for the ER, you're going to need a Hitchayvut. Don't worry, that Hitchayvut is going to be automatically issued when you have the right referral to go to the emergency room. Other things to bring to the emergency room are your Tudat Zahut, your Kupat Holim card. You're all going to get an insurance card, right, with your name on it. Bring that and bring a phone charger and some snacks. It is probably going to be a while. once you deal with your issue, you've taken care of what you need to. Thank God everyone's fine. Go home, get a good night's sleep. The next day or a couple days later, be sure to follow up with your family doctor. I always tell people this because they don't always realize that the Kupot and external clinics or hospitals do not actively share information. There are some times where it's successful in transferring over the information from one place to another, but again, it's not an active thing that is done by the hospitals. So there are times where if you go to a hospital, especially in an emergent situation, it won't end up in your medical file through your Kupat, and it's always good to follow up with your family doctor to make sure you have all your medical documentation, in check. A few other.
Just to jump in on that for a second,
yes.
I use the Maccabi website a lot. Like people, when you go to Terem, when you go to the doctor, the portals that the different Kupot have are really a great place to go check results. So just make sure that you know how to navigate around the website and get access to the information, because it all ends up there as well.
Exactly. So yeah, we're going to get to that at the end in my tips. But yeah, it's an important point to use your online portal. But again, even with that, I definitely recommend follow up with your family doctor after going to a hospital or an emergency room for anything, just to make sure everything's there and everyone, is on the same page about your medical care and what you need. A few other general tips about urgent care and ER. Anyone here who has young children, if you have children under 5, really try to push and get a referral directly to the ER. Oftentimes the first stop is going to be urgent care, whether that's by, your own choice or the Kupaz. It's not only because the Kupa is trying to save money and it's cheaper to send you to urgent care. It's really to your benefit. If you can get something taken care in urgent care in a term, it is likely going to move a lot faster. You'll get what you need. You don't have to do the whole process of being in a hospital. We all know emergency room waits can be endless. But for children under 5, urgent cares are very hesitant to make a final diagnosis of a child under the age of 5. They do not want to take responsibility for that. And more often than not, even after you spend a couple of hours in the urgent care, and I'm speaking from personal experience here, they will end up sending you to the emergency room anyway. So it's good if you can, when you speak to someone on the phone, if you can kind of nudge them to just give you that referral straight to the emergency room. The other tip when going to any urgent care or emergency room is to make sure the referral is clear. I said this before, but this is even more important when dealing with emergency rooms. I'll give you an example. Going back to those children under 5, once my son, when he was younger, thank God he's fine, no one worry, but he had this weird viral hip situation. We didn't know what it was at the time. He suddenly spiked a fever, couldn't move, couldn't walk, was complaining of severe joint pain, all of these weird things. It was after the Kupa was closed. We took them to an urgent care where they, of course, were not prepared to give him a final diagnosis, and they sent us to the emergency room. On the referral to the emergency room, the treating doctor from the urgent care wrote that my son was being sent to the emergency room because they were suspicious of a bacterial bone infection. An infection of the bone, a bacterial infection of the bone, is a big deal. We were taken really, really, really quickly when we got to the emergency room. Now, of course, I'm not telling you to, tell your doctor to be over dramatic and squeeze you in before the line or any of those things. But it's really important that the referral is clear what the actual issue is, what the real concerns are. Make sure to have on there any diagnostic test that the doctor is looking for or that you might need in order to rule certain things out. Because if you don't have those on the referral, ultimately it's going to be up to the decisions of the doctors and nurses in the ER. And there's nothing wrong with those doctors and nurses in the ER. But again, it's always helpful when your referral is clear and you know exactly what you need. Another tip, look up your local urgent care and which urgent cares are covered by Kupa. Like I said, Milched has this whole thing in Jerusalem. Khalit, I know in the Merkaz has a different urgent care they work with. Maccabi tends to work with Terem. But again, you want to check that out before, because none of us want to be in a situation, where we suddenly need stitches and we don't know where to go and we go to the wrong place and end up with a bill. And while we're on the topic of bills, if you make a mistake, try to go back to your Kupa and get partial or full reimbursement. This tip I'm going to give you, let me be clear, I am not telling you not to pay your bills. I am not telling you to try to skirt the system, none of that. What I am telling you is that if you end up in the emergency room and you either thought you didn't need a referral, because there are some cases, obviously, like I said, especially life-threatening emergencies, but also some other cases where you can go to the emergency room without referral. And let's say you thought it was one of those cases, or you didn't think it was one of those cases, and on the way to the hospital, you called the Kupa Moked. Don't wait to drive to the hospital until you're off hold with them. Get in the car and call them on the way. And you thought you did everything right, and you thought the referral was sent, and you get the care you need, and now you're leaving the ER, and they're like, we didn't get the right referral, you don't have a referral, you need a referral, we don't have the Hitchayvut, any of those things, they're not really going to do anything then other than hand you a 900 shekel bill. Now, if you think that you are entitled to have that visit to the ER covered, do not pay the bill on the spot. Again, I'm not telling you to run away from your bills, but if you go back to the Kupa the following day and you bring them your discharge paper and you bring them any other paperwork, whether it's a referral or any other paperwork on your online teak that exists that shows that you really needed this care, sometimes they will give you a full reimbursement. More often than not, they'll give you a significant partial reimbursement. And then basically the Kupa will send a Hitchayvut to the hospital for the amount that they're willing to pay, and you'll pay a copay directly to the Kupa, which is often much, much less than what you're going to pay the emergency room. So this is just something to keep in mind. If you do end up stuck with that 900 shekel bill before you run and pay it, take a couple of days to try to sort it out with your Kupat Holim and see if you can get any money back. And then if you see that you really did make a mistake and you've been fighting with them and they really won't cover it, so then in that case, obviously, pay your bills, but don't worry. In Israel for ER bills, there's 60 to 90 days until you have to start paying fines and the collection agency comes out of you. So you do have a grace period, but don't forget to pay your bills. Also try to get reimbursed. With all of that information, I'm gonna end really with general tips about managing your medical care in Israel. This is really important for people who are not yet in Israel and also people who are living here. The first tip I give everyone is do this shilluv, this combination of in-person and online. You want to use all the different ways of best accessing your medical care. So the first piece of advice that I give everyone is go into that clinic. Remember when I talked about the branch secretary? Go into your clinic in person so they know who you are. I'm telling you, it makes a difference. When I walk into my local clinic, I know everyone's name. Everyone knows my name. It puts a face to a name, and they really start to see you a little more as human and not just another person on their list. And that can really, really help to get you what you need. On the same token, you don't want to be schlepping into your Kupa every day. So definitely take advantage of the online system. Everyone can sign up, and you have to register usually by phone to get an online login. You can do a lot of things on that portal. You can make appointments. You can make requests from your doctor, whether it's a referral, whether it's a prescription, any of those types of things. You can check up on your results for tests. It's a little bit confusing for people who are not comfortable in Hebrew because there is really no good English site available. But I really encourage everyone to try to take a few minutes. You can obviously reach out to us for help or find a friend who speaks Hebrew and just learn the few clicks to get you what you need. It can really make a difference and make your life easier. The second tip I give everyone is organize your medical documents. This is for all you pre-Olim. If you are making Aliyah, please do not come here without a medical summary. You don't need to bring a 15-inch binder of all your medical information. No one here is going to be interested. However, and this is particularly true of people who have pre-existing conditions or on any sort of medications, just bring a one-page letter from your treating doctor that says, overall what your health is. Do you have any pre-existing conditions? When your diagnosis was? What medications you're taking to treat whatever diagnosis you have? What medications you've taken in the past that haven't worked? This is going to be a big thing for you to have. The last thing I want is for you to go and finally, after however many weeks or months you move to Israel, you finally get an appointment with an endocrinologist and you say, hey, I just moved to Israel and I have had this thyroid condition for 20 years that I've been managing with such and such medication. And they're going to look at you and say, okay, how do I know? You really should bring some sort of proof. Sometimes doctors obviously are more lax and do trust people, but ultimately you're going to want to try to avoid either a delay in receiving your medication or having to go for excessive testing. So just bring that documentation. If you're already in Israel, again, just try to keep things organized. Make sure the information that is in your portal, that is in your teak, is staying up to date. Make sure there is continuity of care. And that leads into my third tip, which is manage your own case. This is really, really tough. I know it's hard. And at the Shira Pransky Project, we're going to do the best we can to help you. But ultimately, you can't expect your doctor to be your case manager. You need to do it yourself. You need to be proactive. There are really times where it sounds strange because you are not the medical professional, but you will literally just have to tell the family doctor what you need. And this is not because doctors here aren't trained, and this is not because you know better than the doctor. It's just how the system works, that sometimes you just have to call up your family doctor and say, hey, doc, please give me a referral for a blood test. Please give me a referral for this specialist. And that's a really good way to manage your own case. The fourth tip I give everyone is do not take no for an answer. Welcome to Israel. If you are rejected, ask again. file an appeal. Sometimes it's just that there was the wrong paper. Sometimes the letter wasn't written in the right way. Sometimes, I can't tell you how many times we have people come to us and they say, hey, we contacted you guys. You told us that we're entitled to this benefit. You told us that we're entitled to this reimbursement. And I walked into the branch secretary like you told me to. And I said, hey, I think I'm supposed to get reimbursed this. And she looked at me and she said, and about kaza. There's no such thing. Try again. Ask her again. Ask someone else. Go back in and nudge a little more. Obviously, there are some times where, at the end of the day, you're not entitled to it. But more often than not, it's usually just a technical thing that either requires asking again or slightly different paperwork. So really don't take no for an answer. My fifth tip to all of you is to use your resources. I'll show you, we're about to end and I'll show you all the resources that we have. Get help from us at the Shira Pransky Project. Review our All Rights Index. Don't be afraid to ask for help, whether it's from us, whether it's a friend. I know this is harder for Olim, but use your protexia, as we say. We're not all native Israelis, so we may not have 13 cousins who all work in the top hospitals in Israel, but you might have a third cousin who one time worked in a medical branch in Haifa and, call her. The last tip that I give everyone is to manage your expectations. I'm not saying that in a negative way. The Israeli healthcare system is unbelievable. It provides you with everything you need and more. I think that people sometimes don't realize the amount of care and the number of benefits we have for the basically nothing that we pay. But on the same token, it is not going to work as your old healthcare system. And so certainly don't expect it to. With that, I'm going to leave you with some of these resources. The first, of course, is us at the Shira Pransky Project. If you have any questions, whether it's questions that we don't get to in the Q&A or on this presentation, if you have personal questions about your general medical situation or healthcare situation in Israel, please do not hesitate to contact us at info@shirapranskyproject.org. You can visit our website, shirapranskyproject.org. We have tons of articles, guides, advice, organizational directories that will help you. We have our All Rights Index, which is hosted on Kol Zchut, but everything on there is ours. Between our website and our All Rights Index on Kol Zchut, we have over 700 pages of translated and original content on healthcare and medical rights and different tips and tricks like that in Israel. So I really encourage you to check it out. If you do need recommendations for whether it's doctors, whether it's a question on the healthcare system that you might want to open up a little further, you can join our Facebook group, Navigate the Israeli Healthcare System. It's a really wonderful resource, very active group. Of course, as Rafi said at the beginning, for not healthcare and more of the day-to-day going through the offices and stuff like that, definitely reach out to Olim advisors. His contact information is here. And I'll just end with the fact that we are a fully nonprofit. We don't charge for any of our services. I believe wholeheartedly that healthcare is a right for all and that everyone should have equal access to their rights and benefits, and therefore we do not charge for our services. But because of that, we are obviously reliant very heavily on donations. So if you can, please consider donating. If you want to sponsor our workshop or one of our programs, you can feel free to email me at the email here. And that's that. I guess now, Rafi, I'll turn it back to you and we'll open up to our Q&A.
Amazing. Thank you so much. Wow. Now you can take a deep breath and relax.
Yes.
So I just wanted to go through a few questions that we have here.
Sure.
I think the important one to start off with is just giving everyone a quick update on the corona vaccine situation and where kind of things stand there. And I know there's a lot of details that go into this, but just a quick update I think would be helpful.
Sure. Okay. So, I think we've all seen, listen, I'm the first person to be critical of the Israeli healthcare system, but one thing we have definitely gotten right is this vaccine rollout. It is going really well. It is working at high speed. The general update is that as of right now, they have started on the second dose of vaccinations for people who have already received the first dose in the previous 3 weeks. And what that means is that for the next week, possibly 2 weeks, there won't really be any first vaccinations given out. So that's just something that's important to keep in mind. Currently, they are vaccinating anyone over the age of 60 or people over the age of 55 who have any pre-existing conditions. The Kupot are sometimes a little lenient. It depends on which Kupa. And if you think that you're someone who should be eligible immediately for a vaccine, you should call the Kupa. You'll wait on hold for a really long time, find something else to do while you're waiting on hold. But call them and explain the situation. They may be able to get you in for an appointment. The next group of people that will be vaccinated is anyone over 50. And that's more or less the situation. I know a lot of people have been talking about this, going at the end of the day to try to get a vaccine. It has worked. It's definitely something that could work. I don't think you'll be as successful this week because they are so focused on the second dose. I'm not sure how many spares there'll be, but if you're someone who isn't eligible and you feel pretty desperate to get one, which I think we all can understand, you can, listen around onto the WhatsApp groups and see which clinic posts that they have extras and try to go there. But overall, the Kupat will tell you when it's your turn, and your turn is probably coming soon because thank God we have a lot of vaccines coming. And the other thing, sorry, I just want to add about Corona in general is that I'm not sure if everyone heard, but as of now, the Ministry of Health issued a new regulation that you're required to have a Hafnaya, that referral again, to get a Corona test. They had stopped doing that for a while because they wanted everyone to kind of just go and easily get tested. But there's been a lot of backlog in the system, and now you actually do need a referral to get a test. You can call your Moked to get one, do it online, ask a doctor. It's not complicated, but just be aware that you need a referral if you are going to get a Corona test now.
Okay, great. So we have a question about travel insurance and who covers that and how does that work?
Okay, so travel insurance in general, there are a few different ways. It's, again, everything's much more complicated now because of Corona. You can get traveler's insurance typically through your Kupat, but the important thing again to understand is that it's not traveler's insurance as in it's your Kupat, and therefore anything goes. Your Kupat is effectively outsourcing the traveler's insurance to a private company, and that means that you can be denied for pre-existing conditions, for age, any of those things. Most of the Kupat now are not offering regular traveler's insurance, so you will have to go directly to somewhere private. Again, you can reach out to us after, and we'll recommend certain places for you to go. But as a general rule, when the Kupat are up and running and offering traveler's insurance in non-Corona times, there's definitely limitations to pre-existing conditions. I've yet to find a traveler's insurance that covers anyone over 75. Maybe there's one that goes up to 80, but most will go over 75. And usually there is some sort of time limit, but before Corona, it was a pretty long time that you could go.
Got it. We have a question about different therapies, OT, PT. Is that considered a specialist, or how does that work? If, for example, someone's kid needs PT.
Okay, so there's going to be a big difference between pediatrics and adult PT and OT. If you're dealing with a child under the age of 9, usually you're going to go through what's known as Kupat Holim, the Childhood Development Center. In general, for an adult, in order to get PT or OT, you just need a referral from your family doctor or a specialist. Usually a family doctor is enough, and then you call just to make an appointment. It's not quite considered a specialist, but it's also not just a regular thing that you would do without a referral. By law, they're actually required to give you an appointment within, I believe it's 3 to 4 weeks. If you're after a car accident, they're required to give you an appointment within 9 days. They will tell you they have no available appointments. Remind them that there's a law that means that they do have available appointments. So that's just something for everyone to know. If you're dealing with children, it's going to be a slightly different process, but you're going to start with getting a referral from your pediatrician. You may also need some sort of documentation from the Ganenet or anything like that, and then speak to your branch secretary, and they'll direct you and funnel everything through Kupat Holim, and you go through there, and that basically takes care of all of those therapies.
Okay, great. People are asking, how do they reach the branch secretary? You stress getting to know them, but is there a number when you call the main Moked? Can you ask for the number of the branch, or how does that work?
That's a good question. Don't call the main Moked. When I say talk to your branch secretary, I don't mean call the main Moked. The main Moked is a bunch of people who have been trained as effectively telemarketers to answer the phone and give you basic information. When I mean your branch secretary, I mean that you will find that through your experience of navigating the Israeli healthcare system, you'll have a main clinic that you go to. That'll typically be the one that's either close to your house or where your family doctor is. And in those clinics, there are secretaries. Every one of those clinics has a phone number. You can just Google it. They're usually online. Either press 1 or press 0. Don't fall into the trap when you call your local clinic. They're going to say, press this to speak to the Moked. Don't do that. They'll transfer you to the Moked, and you'll end up in this cycle of speaking to nobody. Either 1 or 0, it depends on the clinic. Just listen for it, and then that'll get you directly to the secretary of your specific branch, and they'll be able to help you.
Great. We have a couple of questions from people who aren't Olim Chadashim, but they're here. So there's one this person here that's on a work visa, right? A lot of people who came to Israel and didn't make Aliyah, and they want to make Aliyah from within. We also have a question about a lone soldier and asking about the 6 months wait period. So if she got supplemental, how does it apply for people who are not Olim Chadashim? How does the wait period and the coverage work?
You're talking about general insurance, not supplemental, or both?
Well, for the people that are here who aren't citizens, so people that come here on a work visa or a tourist visa, are they entitled to coverage from the Kupot?
So it's going to depend on what visa they're on. The only visa that I know of that you would eventually be entitled to full coverage by the Kupot is an A1 visa, which basically there are different types of visas in Israel. The A1 visa is the only one where you accumulate residency. So if you're on an A1 visa and you accumulate residency, which means you've been here for 6 months and you're paying into Bitul Halomi, so then you would be entitled to join the Kupa in full and get all the services and not be denied for pre-existing conditions, etc. If you're not, if you're here on some other sort of visa, the Kupot all have non-resident plans. They've been expanding them more and more over the years. They used to be pretty comparable to regular private insurance plans, which is what people used to do. And the Kupot now more and more expanding them to try to lure people in to pay for them. And also, because if you are planning on making Aliyah, it's a good transition because you'll already be in their system. But if you are on one of those visas, again, it's going to be the tourist plan, so there are going to be some limitations. In terms of the lone soldier, if you're a lone soldier, and whether you've made Aliyah or not, but if you make Aliyah either right after you come out of the army, or if you made Aliyah and then went into the army, you don't have a 6-month waiting period. You just, after you finish the army, you go into Bitul Halomi and just sign up and remind them that you're a civilian again, and your Kupat Holim will kick in right away.
Great. Then there's a question a couple of people asked about choosing supplemental. So if you're making Aliyah, do you choose it at the airport, or do you just choose your regular coverage and then you upgrade once you know what you want to do? What's your thoughts on that?
You can't sign up for supplemental insurance in the airport. They won't let you. When you get to the airport, if you come, this is also only true if you come on a group Nefesh B'Nefesh flight, you'll be able to choose your Kupat Holim in the airport. But even that, you still, after the fact, need to usually go into the clinic or certainly call up at least to officially instate your Kupat Holim card. And then once you do that, you can call in and you can basically speak to anyone at the Kupat. You can call them, you can call the branch secretary and just say you want to join supplemental insurance, and they'll just ask which one and tell you how much it costs, and that'll be that. But you can't do it in the airport, so remember to do it a few days after.
Okay, great. And then you mentioned the 6 months waiting period. A few people asked, what happens if you leave the country during that 6 months? Does that have any impact on that 6 months waiting period?
So for the 6 month waiting period, if you're talking about the base, just general healthcare coverage, I'm referring to people who are toshavim chozrim, so that means they're returning residents, those types of things, or if someone's not maintaining residency. If you, let's say, we're in Israel, and again, this is really a pretty complicated issue, so anyone who is in this situation, I really encourage them to reach out to us directly. If you've left Israel, there are different ways that you can continue to pay into Bitul Halomi and different reasons why you would still be considered a resident, but typically the maximum is 5 years. It's usually as little as 1 to 2 years. Your residency will lapse and your health insurance will lapse. And then when you come back to Israel, you have to reinstate your residency, which means you have to be here for 6 months of the year. If you come back and you leave within those 6 months, then let's say in a calendar year, if you came for 3 months, you left for a month, and then you came back. So then, it's going to, the first 3 months will count, the fourth won't, and you'll continue on from there. It's really, really important to understand this issue. There was a certain period of time at the beginning of Corona where they stopped that, and they said these months don't count against your residency. But for many of our clientele, it's irrelevant, because if you left Israel 20 years ago, it doesn't matter that between March and June 2020, they didn't count your residency against you. And it's really important. I can't tell you how many people make this mistake, and it kills me, because it is so important to have health insurance. If you are a returning resident, please contact us. If you have a pre-existing condition, you really could end up in an issue. They do have an option through Bitul Halomi you basically pay a 12,000 shekel upfront fee to try to waive the 6 month period. But the really important thing that I want to stress to everyone is that it's still subject to approval by the Pidam Bitul Halomi, and you have to prove to her that Israel is the center of your life and that you're here for good reason, all that type of stuff. And we have had unfortunately many cases where, a person came back and they had a home here and they had a job here and all those things, but because they had a very severe pre-existing condition, Bituach Leumi said, oh, well, you're obviously only coming back for medical care, and they rejected them. And in that case, you're in a very difficult situation because you won't be entitled to private insurance either. So I really, really encourage everyone who's in that situation to please reach out to us, and we'll go over your case personally because everyone's situation is going to be different. I want to make sure you all end up with health insurance when you get here.
Got it. And then we have a couple questions about contact lenses and going to optometrist. Is that covered also underneath the regular coverage?
So for basic coverage, you can always go to an eye doctor. Contacts are pretty much never covered. I think a couple of the Kupot have some deals with contacts that you can get reimbursement, but not many. Most of the Kupot for supplemental insurance do offer some sort of, optometry appointment and glasses coverage for people typically that are older, or like a lot of these types of things are like kids or the elderly. The only Kupat, to my knowledge, that consistently offers a significant subsidy for glasses is Maccabi Shali. That's Maccabi's highest level of insurance, and they do offer that once every 3 years. They will give you, I believe it's up to 1,000 shekel for a pair of glasses. The other Kupot don't have as good of, coverage in their supplemental insurance, but even within that, there's usually things you can find. Sometimes, let's say Meucharet's highest insurance, they don't have a specific thing where they give you money towards it, but they technically work with some, glasses stores that you might get a slight discount. And that's, more or less optometry here.
Yeah, great. I think we're going to end up with that. There's a lot more questions that get into kind of specific details, and I think that's something that Ayala would be happy to speak to you directly about, or somebody in her team. So I want to thank everyone for joining, and Ayala, for you and taking the time to go over this. I think it's been really informative, and most importantly, we both wish you guys to keep well and to stay safe, and let's all make sure that we're taking the precautions necessary to get this under control. And so we wish you a very good week ahead, and just keep an eye open for different webinars that both we'll be doing here at Olim Advisors, as well as the Shira Pransky project. We really want to help you guys through this process and adjust your life in Israel, and we're happy to help in any way that we can. So thank you so much.
And I know I saw a couple of people ask just to get the contact info, so I guess I'm going to post it here in the chat, but it's info@shirapranskyproject.org. That's our email, and really feel free to email us, and a healthcare advisor will get back to you.
Amazing. And I'll send out an email with the link to recording within the next couple of days. So everyone who registered will have that, and you can watch it over and over again to absorb all the information. So Thanks, everyone. Take care. Be well.
Thank you so much. Have a good night, everyone, or good day, whatever time zone we're in. Thanks. Bye.